discuss this afternoon some of the challenges that face private investors in the healthcare business, in the ever-changing healthcare market in the GCC region and the MENA at large. We have a very distinguished panel, I'm glad to say, with a huge amount of experience, expertise, and diversity. I will introduce the panel in a couple of minutes. But one thing is for certain, the speakers this morning and the panelists have talked about the capacity gap and the mismatch between supply and demand of healthcare services across the MENA region. One thing is clear for me, at least, is that that capacity gap will not be bridged solely by public sector. The private sector is probably going to be the engine, the motor, the driver, and the turbo machine that pushes to fill that capacity gap and raise the level of healthcare business to a level which is acceptable or desirable by the population of this region. So without further ado, I will introduce our distinguished panel, and I would ask them to join me here. I will start with Dr. Azad Moopen. Dr. Azad Moopen is a well-known veteran of the healthcare industry in the region. If I am to characterize his biography, it's one of incredible success and achievement, from a single doctor operation to one of the largest healthcare conglomerates in the region. It's no mean feat. Dr. Azad Moopen started his life as a lecturer in India, and from there he built what can be only called a healthcare empire, where he focuses on quality and he focuses on bringing satisfaction to his customer base. You just have to drive on the streets of Dubai to see the Medcare and Aster signs appearing on every street, the last of which was the women healthcare hospital that opened on Sheikh Zayed Road just a few weeks ago. I would like to ask the panels to give us their views on the challenges that the introduction of insurance poses for the healthcare, the private healthcare industry, and the opportunities that the introduction of mandatory insurance provides to private investors in the healthcare business. I'll start with Dr. Azad Moopen, and we'll proceed from there.
Thank you, Mr. Nabil. Insurance is something which we have to live with, and we are very happy that it's happening in UAE. So we had this first in Abu Dhabi, then now in Dubai, and I'm sure it's going to be there in all the other Emirates also. In Saudi Arabia, a large portion of the population, the expat population completely are covered by insurance. Here it is mandatory for the local as well as expat population in Abu Dhabi, and Dubai also has schemes for that. Now, if you look at the plus points of coverage through insurance, definitely there is an increase in volumes in business. There is no doubt about that. Because people who couldn't afford earlier now have the ability to access healthcare, and that increases the volume, which definitely helps the providers from the point of view of, and it also helps in improving the quality of service. Many times what happens is that when you have patients coming in who may not be able to afford an investigation, you were forced not to do that earlier. And there were situations where you were holding back. So here you have the ability to do investigations that are required, and to admit patients who are requiring admission and provide quality. So there is, healthcare basically has got three things. One is the accessibility, which increases by this. Second is the affordability, which definitely from the patient point of view increases by this. And third is quality. So these three are the basic requirements for any good healthcare organization or system. So all the three are served by this. Now, looking at the other side, now from the side of the insurance companies, they have challenges like there could be misuse of the system by the providers. There could be overuse, and that is a major issue which has happened in some of the places where the insurance companies are not able to meet the expenditure through the premiums that they collect. Now, the other major issue is that the other side, where the insurance companies want to squeeze and bring down the cost so that the providers are finding it extremely difficult to live with. So I consider this period as a very turbulent period in the next 5 years till it stabilizes. And there will be a system where people will get the required service at best quality service, and the insurance companies and the providers will be happy.
Speaking after 11 years of experience after the CCHI implementation, there was a lot of course, changes and legal framework governing the relation between the hospitals and the insurance companies. That was, of course, was very helpful. But speaking also about the provider who have alternatives, payers, insurance has been not the preferred buyers for the hospital in Saudi Arabia because their margins is not like the others, especially if we're speaking about the Ministry of Health that was buying our services for the last 5 years. The margins was much better than the insurance company. The same thing with the providers that they work with, Aramco company as well. The margins was completely different than the margins that we are speaking about with the insurance companies.
In Dulsco and in my position, I play a dual role. I act as a payer on behalf of Dulsco, taking care of 12,000 employees. At the same time, as an operator, I look after the management of the medical services for not only for Dulsco but for other companies. It has been a great journey for healthcare in UAE. The transformation and the structured progress definitely has been very good. And the last step, which happened in 2013, where mandatory insurance came into place, the law came into place, and it started getting implemented in 2014. That was the first phase when companies with more than 1,000 employees had to mandatorily get their medical insurance. And Dulsco was one of the first companies who implemented this with support of insurance companies. Now, for us, it was not an additional cost because before the insurance era, Dulsco used to take care of their employees with their own medical centers, plus they used to cover the complete cost. But I understand from the market that for many companies, it is definitely an additional cost.
So definitely, as you would notice, that UAE did take tremendous steps in the healthcare industry, much of which is thanks to the mandatory insurance that has been applied in Abu Dhabi and now in Dubai, and I think Sharjah is almost there, and there ought to be a federal system that will inevitably do this. Now, the good side of it, there is an Aster clinic next to my home, much closer. Actually, there are 3 quite proximate to my home, and that gives me a level of comfort. The only option I had before was a very packed hospital that I had, although 5 minutes away, but so packed that I would lose hope by the time my chance comes. So definitely, mandatory insurance is making people's life much, much better. And I think in the long term, it will evolve the healthcare industry in totality, the whole supply chain, in order for us as a country be able to grow our own intellectual property. The likes of technology, we can grow our own technology. So a whole sector can come up on the back of a mature healthcare industry, and on the back of that is a mandatory insurance system.
One of the things that one of the early speakers this morning, the gentleman from Ernst & Young, who gave us a view of the trends in Saudi Arabia, he went through several of the trends, global trends. One of them is technology and the proper harnessing of technological development to reduce the cost of healthcare and improve the quality of healthcare and increase the efficiency of healthcare. So I'd like to ask our investors who have their own healthcare facilities, Dr. Moopen and Malek, to tell us a little bit about what they have done in the field of technology and how they have implemented technology to help improve their performance and reduce their cost and increase the satisfaction of the patient community.
Sure. See, healthcare unfortunately is one sector which hasn't taken up IT to the level where other businesses took it. If you look at many other industries, like for example banking, none of us go to a bank now to take cash or to do any transaction. We sit at home and do it. And many of us don't go to a retail store to buy anything. We do it over the net. And if you look like that, there are a lot of things which have happened in many of the industries, financial industry or anywhere, if you look at hotel reservation, airline reservation. But healthcare still, even now, runs to 95% man-to-man, people-to-people. Technology has not actually conquered it. So there's a huge potential for bringing technology to healthcare and reducing the cost as well as increasing the efficiency. I'll just give you an example. We don't have too much time, and this is one subject which I'm very passionate about. So if you look at, is there a requirement for a person to go to a clinic and do a consultation for a minor illness? We as a doctor, me as a doctor knows that 75 to 80% of all illnesses are diagnosed on the history. As you hear the patient telling what he has or she has, you make a diagnosis, which is confirmed by some physical examination like the stethoscope, which is more like a showpiece rather than actually conveying anything to you, or many times even the investigation. So only 10 or 15% times you have to resort to other things. So as soon as the doctor hears the history, he knows what the illness is, and he can say that, okay, further investigations or tests are not required. So in such a situation, if the patient can call a doctor in a clinic or at his home or anywhere and have a consultation over the net, maybe using a Skype or whatever technology, and the doctor listens, and if he decides that a prescription can be given without asking this patient to come, and that prescription can be actually sent to a pharmacy from where he can be home delivered. In Dubai, we have the home delivery also. So he sits at home and gets some medicine without moving from home. Whereas it takes him 4 to 5 hours now to complete that process, and all the difficulties of that and the additional cost can be reduced. So I'm just giving an example. This can happen in many other areas. Investigations can be done at home by the patient itself, or somebody can be sent and it can be done easily. So there is a huge opportunity for reducing costs through technology and even improving quality through technology if you are doing that in the proper way. So apart from the other things that we do, like now we do HIS, we do other softwares for the hospital and try to streamline things, patient registration, patient allocation, and investigations, patient portal for looking at the investigations. All those are important and are happening. But it can go much further, and we have to go much faster in healthcare to reach a stage where healthcare can be much more mechanized or IT enabled rather than what it is now.
I guess with the elimination or reduction of the need for physical presence, you can democratize the healthcare provision, because you can spread it globally. I mean, you can have doctors that are not necessarily in the same town or the same country or even the same continent.
No, that's a very, very important thing. See, if you want look at for a small place like Dubai, it's fine, or for the GCC, it's fine. If you look at Africa or Asia, how do you reach people who don't have any access? They don't have a doctor in 100 kilometers. So the only way is through the mobile technology, if what I said can be done. If you have an app through which you can access the doctor, or a medical social worker goes and that person has access to the doctor sitting in a city, that becomes much, much more, and that is actually the health for all which will happen. So that is the only way in which you could provide healthcare for larger populations.
A lot of things that to encourage staff to stay, investments of staff, and a lot of initiatives that can be done in the hospital level that can reduce the turnover rate. But of course, the change of regulations, it's every day now in Saudi, and the rules for hiring now and issuing the visa is just also changed recently. So there is a lot of challenge, but there is you can find the talent that would come to Saudi Arabia, but the challenge is to retain them and to again to keep them staying for a long time.
Dr. Moopen.
Yeah. See, this is, I suppose, the most important challenge for healthcare, much more than anything, investment or other regulations and all. Getting good people, qualified people, is the most important and difficult thing to any healthcare manager will face. Now, there is a basic issue that earlier we used to get in the GCC, when you look from the GCC or MENA angle, we used to get a lot of people from the subcontinent, especially from India or countries like Philippines and other places. Now, conditions there have gone to such a level that the salary differences which used to attract these doctors or nurses to come to Middle East is coming less and less. And there is a reality that there is a scarcity. Whenever you try to recruit, people are not willing. And even from the neighboring Arab countries, there are issues for people to relocate. So what is the solution? I think there has to be a huge focus by the government. I personally feel that the delivery of healthcare, as has been mentioned earlier by the introductory speaker, will be to a great extent met by the private sector. But there has to be a focus by the government on training people in the different areas of healthcare, starting from nursing, pharmacy, to doctors or whatever is required. Even the private sector can get involved in that. So that is a basic requirement. Otherwise, you are going to face tremendous problem in the next 10, 20, 30 years. You must have the facility to train people, local people, to take up this and increase their interest to take this up, and also to get qualified here as well as from outside. I think it's a very, very important thing to take up.
My question for Dr. Moopen is, you're looking at growing your business across geographies. In particular, GCC, when you look at your expansion plans in the GCC, which particular country interests you most? I know you have done something in Saudi recently, and we talked about a lot of opportunities in Saudi. Is Saudi going to be the one where you're going to be making most of your investment next?
See, looking at the opportunity, there is no doubt that Saudi is the place where you have real population, and actually the advantage of the population is that you have a cross-section of population from children to very old people. Whereas in many other countries, when you look at, it's only young, healthy people between the age of 25 and 55 who come for job here and go back at the age of 55 or 60 who are there. So it's a skewed population which you have in many other Gulf countries, except maybe in Oman and Saudi Arabia. So you have a full spectrum of population there. Now, the 28 million people there and 20 million being local population or even more than that, there is a significant opportunity. And of the total number of hospitals, 220 or 230 are government hospitals, and there are only 40 private hospitals in the kingdom. So Whereas when you look at any other emirate, or I mean country or any place, you will have more of private hospitals than government hospitals. So private hospitals have got a definitely, and private healthcare has got a role there. The issue is that the overall ease of doing business and that entry barriers and doing that business, how you can do that is the only thing. So personally, I feel that Saudi is an opportunity which all of us should explore. The government of Saudi Arabia also wants to do that. Sajia is ready to give you 100% ownership in healthcare business, which is not allowed in any other Gulf country. The only country where 100% ownership is allowed for foreigners is Saudi Arabia. So definitely the government has the intention to do that, and there's a requirement. Only issue is that when you try to do that, it takes much more time than some other Gulf countries. So you get, after some time, you are not able to go forward. So answering your question, we would definitely would like to look at Saudi as an opportunity in the GCC. Among the GCC countries, that's a place where there is a huge potential.
Is what literatures are shouting for. We are just talking, we are talking about either or, but we are not talking about alternative. We are talking about state healthcare service or private, what's called private insurance companies, profit companies. It's not that. There's another schemes of insurance. And the government should not take her hand out of the insurance. There should be subsidies that the government has to pay. Otherwise, we will go and suffer as the Americans. In America, there's 30 cents goes net to the insurance bucket. And there's 40 million Americans who are not being covered by service. If the GCC countries wants to do, then they have to look in the schemes of social insurance. There are several schemes, and I think it's successful and it's succeeded in many countries.
Of the two questions, the first question was on the ease of doing the telemedicine or the consultation. So what I personally feel is that all these apprehensions that we had about many other things, like even making a payment online or ordering something, whether the same thing will be delivered or the policy of taking it back, all this disappeared over a period of time. Like that, in telemedicine, as we go forward, I personally feel that it will be very easy to bring in systems, protocols. It is not an unregulated thing which we are talking about. For example, the Department of Health in Dubai is now putting forth formulations for telemedicine. There are very strict controls which are there where they will be having monitoring and all this. So the authorities have to be there. It is not an open for all. It is something where there will be a regulated way in which telemedicine is conducted, including prescription, how medicines are delivered, how investigations are done. So personally, I feel that that's a way in which world is going. There may be difficulties, but you have to find a way. Otherwise, you will be out of race if we are not doing that.
Thank you. I'd like to conclude by thanking Adil, Malek, Dr. Moopen, and Mubarak for an exciting and stimulating panel. And thank you, our audience, for your pertinent questions.
For not sleeping.
And for not sleeping. You were watching and you were listening. And Adil did not swear once. So thank you very much, and hope to see you again.